How effective are stents? How effective is bypass surgery? And what other regular procedures do you do, and how effective are they?
So stents, I don't do stents or bypass surgeries. I always do casts and would refer them. I don't cast anymore. I don't do the hands-on procedures. Actually, I refer them out now. I was doing that up until like 4 or 5 years ago. However, stents are effective only from the standpoint of relieving symptoms. In a targeted fashion, stents can be effective from the standpoint of relieving symptoms in individuals who have symptoms who are, for whatever reason, not able to follow an aggressive lifestyle modification and who are optimized on meds and still don't have symptom relief. You can say the same thing from bypass surgery. It can improve in terms of symptom relief for patients who are not, amenable to angioplasty and stent and who are not able to follow an aggressive lifestyle intervention and just doesn't have the means or wills to do that. So from that standpoint, in my opinion, they serve as alternatives to a natural disease reversing approach. But I like to think of them as a symptom relief therapy, not so much as a disease reversal therapy. So when you talk about effectiveness, they're effective in terms of reducing symptoms in certain situations. And in a similar fashion, in certain situations, you see some improvement in quality of life for a short period of time. But the progression of disease is not stopped. And that's borne out by the data in trials which show that there's no difference in terms of outcomes, i.e. heart attacks, death, et cetera, with stent versus medication, certainly with bypass versus medication.
How do you decide when it's too late to focus on lifestyle and to instead tell the patient they need an aggressive surgery of some type? And when is it still okay to say, don't do anything medical, just change your diet and lifestyle completely?
That's a great question because I think I like that question largely because it underscores, or at least it points out how we think of lifestyle versus these other treatments as an either or. But I think of it as at the very least of both ends. I think it's never too late to do a lifestyle intervention. In fact, a patient, and I've had this in real life experience, in patients who are too sick for bypass, too sick for stent, too sick for surgery, that's when lifestyle intervention come into play. Now, that's a raw detox diet. That may be me feeding them raw, cold-pressed super greens through a PEG tube and weaning off medication, plus doing other adjunctive therapies. But it's in that situation, lifestyle intervention from the standpoint of superfood and nutritional manipulation plays an important role. So similarly, someone who's going for bypass surgery, well, sir, you have bad severe heart failure, you have cardiac arrhythmia, you have 4-vessel bypass, you're having crushing chest pain, we need to get you to the operating room. I will then say to that patient, you need to start a raw detox right now. The raw detox is such that when that patient in the operating room, you're reducing inflammation, you're reducing cytokines, you're improving the underlying chemical biochemistry, reducing the chance for perioperative atrial fibrillation. So in my opinion, it's never too late, short of the grave, for someone to get on an aggressive lifestyle intervention.
A lot of authors who are very credentialed are recommending keto diets. What is your real world experience? Do people with keto diets do as well as people on whole food plant-based diets in preventing heart disease and stroke, or do you notice a difference in the results?
I have not done a scientific head-to-head comparison with the keto diet with a whole food plant-based diet. What I can say from my clinical experience is that many of the patients whom I see coming in who are critically ill are either following a keto diet or a keto-like diet in many situations. And they're coming in with early or mid range kidney failure, heart failure, and the like. So we've had many people come in on a keto diet, and they have these advanced illnesses. So even though people on the keto diet can lose weight and they feel better, I've never seen an acutely ill patient. I'm talking about someone who's coming in with volume overload, renal failure, heart beating at 10%, needing intravenous diuretics, being put on a keto diet and turning around. I'm not able to see that. Those patients not even able to digest the meat on a keto diet. I have to put those patients on cold pressed juices because their bowels are so inflamed. I've not seen a patient with acute inflammatory bowel disease come in and do better on a keto diet. I haven't done the studies, but most of those patients I'm seeing are coming in on a diet in which they're eating a high amount of animal protein. I mean, the average American's eating something close to a keto diet because most of their food are animal-based protein, whether it's from eggs, dairy, any form of the animal flesh. The only problem with the standard American diet, different than the keto diet, is that they're eating a lot of processed carbohydrates also. And so you can make the argument to remove those processed carbohydrates, make them better. But from a person who's very acutely ill, you have to remove more than just processed carbohydrates.
Do you put people on statin drugs or cholesterol drugs?
I routinely don't put them on there. I routinely do not recommend these drugs. I only use them in a setting where someone has a very abnormal lipid profile and they just don't want to follow an aggressive lifestyle approach. Then I just do that from a standpoint of following so-called standard medical practice. But I don't utilize these things on a regular basis on patients who are following our lifestyle recommendations.
If someone believes they are in good health, do you recommend cryotherapy or jumping in a lake or a river or stream in the winter when it's cold? Is it too shocking to the heart, or is it a healthful idea?
I don't have any clinical experience with cryotherapy. It's something that we plan to look at. I understand other centers use cryotherapy. I just don't have enough clinical experience with cryotherapy to fully answer that question.
Okay. Can we reverse heart disease?
Yes, it depends on your definition, but reversal, as I tend to define it in my clinical practice, is where you're headed on a certain trajectory, and there's a halting of that forward progression. That's one. That's maybe a phase one reversal, a slowing or halting of the progression. And then a turnabout. The turnabout could be a small process where, say, the heart pumping function gets a little stronger, heart perfusion gets better, function gets better, and other parameters get better. Now, it doesn't mean that the heart becomes completely normal, but it means that you halt progression and you turn things around to where there's a certain improvement from the worst point that you were at. And so that, by that definition, reversal, we see that on a regular basis.